Yeah, just a quick review of the INDEEMAX copper knee brace. So this, I think of it more actually as a sleeve than a brace, but nonetheless, it's made specifically for people that have some type of knee problem or are suffering with some kind of knee pain. And the idea here is that, you put on the sleeve and it supports the joint, helps support the surrounding soft tissues around your knee, restricts your knee motion a little bit, and that way your knee has a chance to kind of rest, recover, and doesn't get so overstressed as you're doing things. So a few points about this particular brace. It does have silicone strips on the top here. So a lot of times people have trouble with these things falling down as they're doing things or if they're really active. But these have little strips in there to help keep it in place, so that's good. The other thing I really like about this is 21% nylon. So nylon is a very durable fabric than say versus polyester. So I really expect this sleeve actually to last you a while. So those are a couple things I really, really like. Other things you can do for your knee, besides putting on a knee sleeve, just as one example, this resource is Bulletproof Your Knee. That's where I'm getting this stuff from. If you have any kind of knee problem, make sure you strengthen your quadriceps muscle. That's a big muscle on the top of your knee, and here's your kneecap for reference. It's basically, your quadricep muscle is a big muscle that stabilizes your knee joint. So it's really key in keeping your knee healthy and pain-free. What they're finding now is that people have various problems. When they test, a lot of the muscles around the knee, they find basically it's the quadriceps muscle that gets hit the worst. Either it's weaker than normal, or if they do like a CT scan, it has decreased cross-sectional area, which means it's smaller than it's supposed to be. So here's an example, knee swelling in the quadriceps. Another study demonstrated that even if you have as little as 20 milliliters of fluid in your knee, which is just over a tablespoon, it's enough to decrease the strength of your quadriceps muscle. So if you have chronic swelling, it could put you at risk for having, decreased strength in your quadriceps muscle. Knee injuries in the quadriceps, here again, if you had like fractured your tibia, your lower leg bone, surgical opening of the joint, if you had prior knee surgery, put you at risk for having decreased quad strength. Ligament problems, anterior cruciate ligament, that'd be the ACL, if you've torn that. Look at this, research found the strength of the quadriceps was decreased by 25 to 30%. So here again, a posterior cruciate ligament, same thing, medial collateral ligament, the little ligaments around your knee. If you have problems with those, chances are your quads are weak and you need to strengthen them to become pain-free. Knee pain in the quadriceps, people that have chronic pain, they found there's decreased quadricep strength. Here's an interesting one, knee arthritis in the quadriceps. Actually, tons of research showing that people with knee arthritis have decreased quadricep strength. And likewise, so they take people, and these are randomized controlled trials, they take a group of people with knee arthritis and they strengthen just their quadriceps muscle. They find that the knee pain starts to go away. And they also find that people with the stronger quads, the stronger you have them, the less progression of your knee arthritis occurs. So it's actually kind of a preventative thing to keep, the pathological process of arthritis to continue on. Patellofemoral pain syndrome, I mean, this just goes on and on. So you have any kind of knee pain or knee issues, make sure you're strengthening your quads, at least one good exercise. Fine-tune control over your knee. Here they're talking about stuff at the hip. So basically, sometimes you can have knee trouble, and the problem isn't with your knee at all. Sometimes it's actually up at the hip that's causing the problems. Classic case is iliotibial band syndrome. So for instance, if you take a group of people with iliotibial band syndrome and you test their hip muscles, you find they have really weak hip abductors. And that helps keep your pelvis level when you take a step, brings your leg out to the side. Likewise, here again, randomized controlled trials, take a group of people with iliotibial band syndrome and you strengthen their hip abductors, iliotibial band syndrome starts to go away. So it's just crazy. Optimize knee flexibility. We all know we need to stretch our knee, it bends and straightens. What a lot of people don't know is that your knee actually rotates as well. That might sound funny, but about the last 10 to 15 degrees of you straightening your leg, of leg extension, your leg actually rotates laterally out to the side. And here's a little accessory motion. Well, that's an accessory motion that it has to have for full functioning. Here's a little test to see if you have that. Other things you can do, besides that, one last thing that I know of, proprioception, increasing dynamic knee stability. So here they're talking about proprioception, that's your position sense. So if I suddenly turn off the lights, you'd be able to tell me if your knee is bent or straight, okay? And that's because you have little receptors, nerve receptors in the joint and the soft tissues around the knee, constantly giving your brain feedback as to where your knee is in space. And so what they're finding, if they look at people with various knee problems, that the proprioception, it's not like it's not there anymore, because you really have to have like a neuromuscular disorder for that. What they're finding is it's just not what it's supposed to be. It's just decreased. So here again, just something else you can do to increase your knee function. Get your knee fully functioning, pain goes away. But yeah, nothing's as quick as, putting on a sleeve like this. Usually people put them on and they have pretty much pain relief starts to happen right away. So anyway, good sleeve. Check it out.